Welcome to Lesson 9.3 on workplace violence and incivility, and with a focus on horizontal violence. Nurses working in hospitals and other healthcare facilities are at a disproportionately high risk for physical violence because of the very nature of their job. Healthcare workers screen patients and their visitors to the best of their ability, but no one never knows who will walk through the door and in what mental state. To maintain personal safety and an environment free from the potential of physical violence, nurses must be alert to signs of trouble. Not all healthcare workplace violence is of a physical nature or from patients or their families. Like any other workplace, healthcare settings are subject to horizontal violence and incivility. Horizontal violence includes intimidating or bullying or mocking behavior between and among staff, managers, or physicians. It interferes with optimal job performance and negatively affects the delivery of high-quality patient care. Research suggests that incivility can be prevented if organizations ascribe to and uphold civility norms where incivility is not tolerated. Further, if organizations maintain policies and procedures to address workplace violence and incivility, leaders and staff could be provided with opportunities to learn about how to create positive work conditions and how to effectively deal with potentially problematic situations. No organization can completely prevent or eliminate workplace violence and incivility, but with proper planning and effective programs, the opportunities for such occurrences can be dramatically reduced. Workplace violence and incivility in healthcare have emerged as important safety issues over the past decade. Workplace violence is seen on a continuum from threats or intimidation to its most extreme form of homicide. Violence, whether by persons outside or within an organization, have been shown to have negative effects including increased job stress, reduced productive work time, decreased morale, increased staff turnover, and loss of trust in the organization and its management. The Canadian Centre for Occupational Health and Safety states that workplace violence is related specifically to the acts that cause physical injury and defines workplace violence as any act in which a person is abused, threatened, intimidated, or assaulted in his or her workplace. Workplace violence includes these broad categories. Threatening behavior, for example, shaking fists, destroying property, or throwing objects, verbal or written threats of any expression of an intent to inflict harm. Harassment, any behavior that demeans, embarrasses, humiliates, annoys, or alarms a person and is known or would be expected to be unwelcome. It includes verbal abuse, disrespectful gestures, intimidation, bullying, or other inappropriate activities. Physical attacks is the act of hitting, shoving, pushing, or kicking someone. In recent years, additional descriptions of workplace violence have been added. Horizontal violence is an act of aggression that is perpetrated by one colleague towards another colleague. Lateral violence, which is often used interchangeably with horizontal violence, refers to psychological harassment evidenced by verbal abuse, intimidation, exclusion, unfair assignments, denial of access to opportunities, and withholding of information. Other terms associated with this type of violence include bullying, which is a practice closely related to lateral or horizontal violence, but a real or perceived power differential between the instigator and the recipient must be present in bullying. Bullying usually involves repeated incidents or a pattern of behavior that is intended to intimidate, offend, degrade, or humiliate a particular person or group of people. It has also been described as the assertion of power through aggression. Interpersonal conflict occurs between and among patients, family members, nurses, physicians, and members of other departments. These behaviors exist in what is termed toxic workplaces, which are organizations in which people feel devalued or dehumanized and in which disruptive behavior often flourishes. Incivility includes a wide range of behaviors from ignoring to rolling one's eyes to yelling and eventually to personal attacks, both physical and psychological. The term bullying is often subsumed under the term incivility. Workplace violence and incivility can occur from patients or from members of the public who do not have a direct connection to the organization. As said before, a significant source of interpersonal conflicts in the workplace stems from lateral violence or bullying. Lateral violence or bullying is again exercised through shaming and intimidation, verbal abuse, over-reporting, excluding behavior, less favorable work assignments, denying career opportunities, and withholding information. Lateral violence and bullying stems from subconscious projections whereby one's insecurities as the perpetrator motivate them to establish a dominant position over the peers they feel threatened by. Acts of lateral violence and bullying are associated with psychological and physical stress, underperformance, professional disengagement, increased job turnover, and the potential for diminished quality of care. And so it's important to remember that lateral violence and bullying occur because hurt people hurt people. Therefore, it is best diffused via a compassionate response that enables those who are instigating the lateral violence to address the root cause of their insecurity. Many theories exist as to why horizontal violence takes place in nursing. Historically, horizontal violence in nursing was considered to be a result of nursing's traditional hierarchical structure, the oppression of nursing as a profession or feminism. However, because workplace aggression is common in other professions as well, it is most likely the result of a complex myriad of individual, social, and organizational characteristics. More recently, bullying in the workplace has been linked to worker burnout and decreased access to empowering structures in the work environment, including access to information, resources, supports, and opportunities. When nurses are more structurally empowered, they report fewer incidents of bullying, which supports the proposition that empowering work environments have the potential to decrease incidents of workplace violence of the horizontal type. Regardless of the reasons why it happens, the concerns are that impaired intrapersonal relationships between nurses at work can cause errors, accidents, and poor work performance, and that those relationships may play a significant role in attrition or turnover and retention. Nursing students and inexperienced nurses are especially vulnerable to lateral violence and are generally not prepared to effectively handle it. Newly graduated nurses and students depend on collegial support because of their lack of familiarity with the work environment and work tasks, which makes them especially vulnerable to lateral violence. Unfortunately, this scenario lays the groundwork for a victim-perpetrator cycle, which is a well-established pattern in many nursing cultures. This is evident in that those who are most vulnerable, such as student and novice nurses, become accustomed to being treated as less than in nursing environments. Over time, as they move from novice to expert and begin to garner social capital, and as a result, they climb the hierarchy, and subconsciously many will perpetuate the same pattern by threatening students or treating students and novice nurses in the same manner in which they were treated. Many nurses who suffer from emotional exhaustion and burnout become chronically hostile and remain in the field. When employees continued to work in burned out conditions, it causes ripple effects of adverse consequences for themselves, work teams, and clients. This scenario perpetuates lateral violence, with more nurses hurting each other and perpetuating the cycle of hostility in the workplace. Conflict resolution must be encouraged and supported. Avoid triangulated communication whenever possible, as this erodes trust and a sense of emotional safety in the workplace. However, there are certain situations where direct communication has not been effective, or when the risks of confronting a colleague directly may outweigh the benefits. For these situations, a mechanism for confidential reporting is also necessary. A primary factor that influences one's ability to engage in authentic relationships at work and frequent moments of thriving is the habitual practice of self-compassion. Self-compassion acts as a buffer against the stress produced from making mistakes, role ambiguity, and negative feedback from coworkers. Ultimately, those that can view themselves in a compassionate way might appear to be better able to resolve workplace stimuli and to prevent rumination on negative self-talk before it becomes disabling. Those who habitually practice self-compassion naturally demonstrate compassion towards others as opposed to gravitating towards lateral violence or bullying. This is an interesting study that I've posted for you. It's called Building Empowering Work Environments that Foster Civility and Organizational Trust. Testing and intervention. So the authors studied the impact of a workplace intervention called CREW, which was a civility, respect, and engagement in the workplace. And it was an intervention on nurses' empowerment, experiences of incivility, and trust in nursing management. It was a 6-month-long program, and it was instituted in 8 acute care hospital units across 2 provinces. So a total of 33 units were in the control groups. The CREW program involved weekly unit meetings that were facilitated by a CREW expert. At the meetings, management and nursing staff would develop goals to achieve positive interprofessional relationships, and strategies were selected from a toolkit to support the achievement of these goals. And so what it was found is that it improved the overall empowerment and trust in the management. It improved interprofessional working relationships, and incivility rates decreased over time. So what can you do as a role of the leader? Well, you can encourage positive working relationships, foster open communication and collaborative practices, develop constructive approaches to conflict, and be a role model of professionalism. So in the end, conclusion, conflict is inherent in professional practice environments. Lateral violence is toxic to the profession, and you need to speak out and advocate for respectful and nonviolent treatment of all healthcare staff.